Nexi enables you to quickly connect patients to care by automating client intake for healthcare professionals. This video will demonstrate how to set up Nexi for client intake. We'll start by configuring the project settings and creating intake notifications for our program. Next, we'll walk through how to register a new client, and finally, how to accept the client as a healthcare professional. Let's get started. To begin, log in as the Nexi administrator and navigate to the configuration settings for the Nexi Care Patient Support Program from the Program Builder. Let's configure the enrollment workflow for customer coordinators under the Configuration for Groups tab. We'll set the program to collect the client's location and, before registration, search for available nurses within a set proximity to the patient's address that are trained on the program's drug. To ensure patients are matched with a nurse in their area, registration will only proceed if a nurse is found. If no nurse is found, we'll extend the search to a wider range. Finally, to ensure a client is properly assigned to a nurse, we'll set the program to notify all qualified nurses within the allowed range after a patient is registered. Next, we'll set up additional intake notifications on the notifications page. With Nexi's flexible settings, you can customize when, how often, and within what proximity notifications are sent to ensure clients are rapidly matched with a nurse. For our program, we've created 3 follow-up email notifications if a patient isn't assigned within the first few hours of enrollment. After 2 hours, the first notification will be sent to nurses within 10 kilometers of the client. After 5 hours, the notification will expand to a radius of 30 kilometers. If no response is received after 8 hours, a third notification will be sent to an extended radius of 40 kilometers. Next, we'll log in as the care coordinator to register a new patient into our program and see the intake process in action. Begin by selecting the Nexi Care Patient Support Program. Type in and select the client location to search for available nurses nearby, who will appear in the Google map below. Then click Submit. This takes us to the Register Client page. Complete all the required details, including their basic details, address, the participating physician details, and any prescription details. Then click Save. After enrolling the client, a confirmation message will appear at the top of the screen, showing which nurses have been notified via email. The first nurse to accept the client will become their primary caregiver and ongoing point of contact. The full client dashboard is now available and can be managed as needed. Next, let's review how a nurse accepts a newly enrolled client. Earlier, we configured our program to email all nearby nurses when a client is enrolled. Here are 2 examples of email notifications received by nurses. Each email includes the client's location, the nurse's round-trip travel distance, and the payments they will receive for each visit if they accept the patient. Rates are determined by various factors, including distance to a patient's home. To accept a patient, click Accept this client. A message will pop up from Nexi asking Jennifer to confirm the client. If Jennifer accepts, this will take her directly to her Nexi dashboard, where she can see her new client in her client list. At the top of her dashboard, she can see a map of all her clients and filter for those with upcoming visits. Hover over each pin to see each client's details and how far they live from the nurse's home. If another nurse now tries to accept this patient, they will receive an error message that the client has already been assigned. This concludes the demonstration of automating client intake for nurses in Nexi.